David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington, and today we're going to be doing part one of best exercises for chronic low back pain. This is great to do, especially when you're not in the acute or acute chronic situation. So you're able to actually move and do these type of movements. If you have to, you can modify them and do a little bit less, or as you get stronger, do a little bit more on there. Obviously, this is not a substitution for medical or healthcare advice from your chiropractor. This is something that you can do when you have chronic low back or back pain. And so chronic usually means 3 months or more, or even more than 4 episodes that you've had, 4 or more episodes of back pain. And the purpose of this is to create some motion or movement and hopefully stabilize some of the areas that have been not as stabilized or exercised in quite a while, especially in a society where we tend to sit in front of computers, drive for great lengths of time. We have weakened core stabilization muscles. That's like what we call the multifidus. These are the lower or the motor type functions that occur, the fine, deep intrinsic type muscles we don't normally use or engage in. And so a lot of this can be done either on land-based or just on a stabilized surface, or what you see here as a therapy ball. This therapy ball or Swiss ball you can pick up relatively inexpensively on Amazon. This one's particularly 65 centimeters, so it's a fairly roundabout average type size ball. You can go higher or lower on them at 55 or 75 centimeters as well. But here we're targeting and strengthening significant areas or muscles that need that core stabilization type exercise. So guys, remember when doing this, do this with caution. Also make sure that no objects are around you, so in case you're not used to using a ball, you don't slip off and end up hitting your head on something when doing this. So keep in mind some of the sets and reps and timing can be done 2 to 3 sets, 5 to 10 reps, 5 to 10 seconds. You can increase that over time. You can go to 10, 20 seconds. Don't make it complicated. The idea is to engage and chew off a little bit or do a little bit of this at a time. So the first one we're going to do is a sitting pelvic tilt, and this can be done with both feet on the floor. And you can do a simple back and forth motion of your pelvis, engaging it back and forth on the therapy ball. You can do it side to side. You're almost rocking a little bit. Side to side. And then you can do a figure 8 motion as well, and do a reverse figure 8 motion as well. So this is what's actually called the sitting pelvic tilt, or tilts that you could be doing. It's really fine-tuning those areas. Now I'm going side to side, now I'm going back and forth. You can do this in any amount of repetitions, but I was just giving you a generalized idea. Forward, backward, side to side, figure 8, and then a reverse figure 8 as well, because you start working around the SI joints, the tiny muscles between the vertebrae. The next one's the bridge, or a backtrack. On the first one, you can eventually do it when you're able to do where you can stabilize on one leg and go back and forth just a little bit at a time. And if you need some kind of support or a counter, just reach toward that and do the same thing if you just need that little extra bit, just like that. All right, so let's move on to the bridge. You could start in a sitting and then walk out so the ball is between your shoulder blades and your trunk becomes parallel to the floor. This way you can push your heels into the floor, and this activates your hip extensors. That's your butt muscles, and to walk to a straight, back up to a sitting position again. You can challenge your balance and hip extensors by raising one leg even when you do this particular exercise. So it's this and this. Now let's get a little bit better position here so you can see. So walk it down between the shoulder blades and back up again. All right, Now we're going to challenge it a little bit. You can do a sit-up, and you'll roll halfway back and hold it for a length of time. So we'll be like this and just hold. And you can hold that for 5 or 10 seconds. You can do that for, you know, 5 to 10 reps. You know, 2 to 3 sets, you know, 5 to 10 reps, however that is. Just, you know, it's holding a duration of time in there, guys. All right, the seesaw. This one's the one where you're going to be in a push-up position, almost hugging the ball, and position the ball under your hips, and then lifting one leg at a time, lifting the other leg at a time. Then lift left leg, right arm, and opposite left arm, right leg. And then you could do it where it's almost like a kicking type motion where you lift both legs at the same time and make it a little more challenging. So let's do that. We're gonna end up getting, let's go into a position like this, push-up position. So we'll start with one, then the other, just like that. And so you can do 2 to 3 sets, 5 to 10 reps. Now you can do right arm, left leg, left arm, right leg. Just like that. Then you can do it where you're out a little further and raise the legs up at the same time as well. Just like that. So you get the general idea of things that you can do. Part 1 with a therapy ball. Part 2, we're going to go over some exercises that you can do without the therapy ball, because you don't always have this along with you wherever you're at, but these are great little exercises you can do in the morning to strengthen it, and I hope this helps stabilize some of the areas, especially if you're a chiropractic patient. Doing these a little bit at a time goes a long, long way. So guys, thank you for watching. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. I'll see you soon. Look for part 2. Bye-bye now.